everybody, and welcome to the second virtual roundtable hosted by ALTIUS Healthcare Consulting Group.
Good afternoon, everyone. Thank you so much for joining us today on this special episode of ALTIUS Answers, as well as our virtual roundtable conversation regarding the impact that COVID-19, the coronavirus, are having on the healthcare industry. Today, we have three special guests with us that are going to share their perspectives on what's happening within their environments and communities. Today, we are joined by Dianna LeVeck, the Chief Administrator Officer from Genesis Healthcare System. She is going to share the strategies that her community and hospital have taken to really have a forward-thinking approach to how they're addressing some unique situations that they're facing in Zanesville, Ohio. We're also then going to hear an update by Pete Stille from SSR. He's going to share some updates regarding availability of PPE and other information that he has gained since our last roundtable conversation. And then we're going to wrap up with Ken Kachmar from Boston Scientific. He is a clinical education manager for the Northeast area, and Ken's going to share some interesting information with us regarding how cardiac services have really adapted within the last 2 weeks, 3 weeks, regarding their ability to actually remotely monitor patients and adapt to a new virtual world. He'll also share some mindset information that's really important as we all work to adapt to working remotely in certain situations and really position ourselves for the future. I'm going to start by just sharing a little bit of information with you on what we've been seeing as the impact with COVID. A lot of things have happened over the last week. Number one of the best changes that we've seen is that the CDC has really recommended that elective surgeries are canceled, which has caused a lot of healthcare entities and systems to begin with some furloughing of employees. Dianna in a minute is going to share an approach that Genesis has taken to that I think is really going to be useful and beneficial to others to hear. What we have heard from our clients and others in the industry that the rates of reported furloughs range anywhere from minimal 1% to as high as upwards of 25% depending on the hospital or healthcare system. In some other areas where they're actually experiencing the crunch of volume, like we're going to hear later on from Ken and some other things in the New York, New Jersey area, there's been the exact opposite approach. But what we are seeing now is that hospitals expect that the volume in these areas are going to deteriorate before they actually increase. So they're taking steps to ensure financial stability moving forward. In addition, in places where coronavirus has already started to grow, and the communities might be starting to see an uptick in volume and or in preparation for those upticks, we've started to see providers and clinicians reassigned to other areas where the projected needs are going to be or the current needs are, so that they can be trained in those new specialty areas or trained in what their duties will be as they're assisting the healthcare organization. UPMC, which is local to the ALTIUS market in Pittsburgh, has taken a unique approach where they've said, we're not going to make any changes right now to our employees, but we're going to keep everyone paid at least through May 9th. And as we reassign them to other job duties, we're going to keep that in flux. So what they've really done is reassigned all of their workforce to the areas that they believe they may need them in the weeks forthcoming. So with the alternate care sites and solutions, we've started to see a lot of updates happening. Communities everywhere are looking for opportunities to adjust the care sites. So they're looking for opportunities to really make sure that they have additional sites available. So we've seen the implementation lately of some drive-by screenings and screenings to triage the patients. We've seen ramped up utilization for telehealth. There's been some reopen of closing facilities. What we have noticed also is in certain areas where you may have underutilized clinics or you might have dormitories or other locations that are available, we have had clients that have actually opened up those locations and started to either work with the Army Corps of Engineers or work with other opportunities to actually repurpose those to treat patients. That ranges from a hospital right outside of Pittsburgh that is currently being revisited and potentially reopened to take an influx of patients coming through in the weeks to come. We have seen hospitals that have converted the single rooms to the double rooms, and we've also seen shuttles that have started to really be put in place to shuttle patient to less crowded sites. Overall, it's really a matter of potentially routing typical emergencies to other locations so that you avoid transmission of the disease whenever possible. I think I shared last week that Temple University Hospital has actually segmented off portions of their hospital and designated them as COVID-19 coronavirus locations. So they have elevators that are being used specifically for those patients. They have entryways that are being used specifically for those patients. And these are some of the changes that we're really seeing coming through in the forefront of care right now. There's also been a few creative solutions that have come out of the housing market. Chicago has rented thousands of hotel rooms, and they are going to start putting suspected cases in those hotel rooms for quarantine. Their city's health department is starting to staff some of that. We have seen quarantine people in that location. They do receive 3 meals, and so they're making sure that they're fed while that they're there, but they're starting to really ration out and quarter out those employees into certain places. UPMC has prepared dormitory space at the University of Pittsburgh, and they're going to use that space to actually house their staff so that if for some reason they feel that they've exposed or they want to self-quarantine so they're not putting their families at risk, they're going to be allowed to stay there so that it's easier access for them to go back and forth to care. So there's a lot of unique things that are happening within the industry right now. And I think Genesis Healthcare has really done some unique things from a perspective of really looking at the employees first. You know, one of the things that ALTIUS really focuses on and embraces is that in order for healthcare providers and healthcare in general to really ensure that we're providing appropriate care for our patients, we must always put employees first. You know, if we're going to really combat this together and unite as a nation, unite as a community, we have to make sure we're taking care of our employees. And with that, I'd like to pass it off to Dianna LeVeck, as she has been with Genesis Healthcare System now for I think over 30 years. And I'll let her introduce herself quickly with her background and then share some of the unique strategies that they've been doing. And I think everyone's going to really find this very beneficial. Welcome, Dianna.
Thank you, Stephanie. I appreciate it. As Stephanie said, I'm Dianna LeVeck. I'm the Chief Administrative Officer for Genesis Healthcare System. We are a facility in southeastern Ohio, and we are sort of a regional hub for about 6 of the contiguous counties to our own. We are about 60 miles from the Columbus, Ohio market. And so, you know, we have not yet experienced the surge that many other areas are being hit with. Obviously, we are taking a great deal of energy and effort to prepare for that. As Stephanie said, our employees are critically important to us, and we have been, as I'm sure many other healthcare facilities have been experiencing, a challenge with being able to keep them working and still maintain, you know, the viability from a financial perspective of the organization. Excuse me. And so we had initially started with doing voluntary absences, allowing people to take time unpaid or use their paid time off. We have found very quickly that that is not nearly sufficient to give people a sense of stability and to really keep them connected to the mission of being the healthcare hub in our region of the state. And so we have taken a little different approach to what we are doing with our employees. You know, I appreciate the information that Stephanie shared on what UPMC is doing. We are not an organization large enough or with the resources to maintain all of our employees at their current FTE. We have done some similar things in looking at every employee's skill set, and we have redeployed staff to areas where their skills can continue to be utilized based on the volume of work that is available. For others, we have taken a position to not separate their employment with us, but have preferred to go the route of a furlough. And the furlough is allowing them to apply for their unemployment benefits so that they at least have some consistency in the flow and understanding of what their compensation and monies might be coming into the home, but we have allowed them to remain on, if they are benefit eligible, on our benefits plan, paying only their portion of the premium as they would at any other time during active employment. This has allowed us to keep them connected to us. In the furlough strategy, we have required them to agree to recall to work within 24-hour notice, because we know when the surge hits, we will have a very limited window of time to ramp up. I think that it's been amazingly well received. As Stephanie indicated, I've been in the healthcare field and with Genesis now over 30 years, and have been through reductions in force and traditional layoffs. Our employees have responded to this so much more positively than I could have ever expected. They are appreciative of this modified approach that we're taking. They have been more than willing to be reassigned, relocate, or step away until they are needed through our strategy. We have, as Stephanie talked about, the varying range of percentages from the volumes that we're experiencing and the productivity that we are trying to get to. We have challenged our leaders to identify about a 10% reduction through furlough, and then we are accomplishing another approximately 5% through reduced hours through VA or use of PTO. So it, in the initial stages, has again been well received. It's a creative approach that we've never taken before, but we are hopeful that our employees will be out there and ready to respond when the community needs us. So, Stephanie, if you have questions or anything additional that I can share, I'm happy to do that.
Dianna, I commend the organization for the unique approach that you've taken to actually identifying steps that you can take to keep the employees engaged. I think, in this time period, the accountability and the transparency of that engagement and communication is so important. So I really think that, hospitals around the country are dealing with similar situations. And I really like the approach of, allowing the employees to stay engaged with the organization, having the 24-hour notice so that you can call them back within a reasonable time frame, that you can ramp up whenever you need to. So I think that's really good. And I don't think we have any questions from the audience right now, but if there's anything regarding, what's occurring from a community response that you'd like to share, feel free, and then we'll pass on to the next panelist.
So from a community response, it has been absolutely amazing. Our community has done a wonderful job with social distancing, and in Ohio, for those of you who are not in a state that's doing this, we are under a stay-at-home order. And I think folks in our area have done a great job with that, but I have just been amazed at how local industries have reached out to us. A lot of our construction firms are shut down. They have donated their N95 masks, their shields. We have owners of these companies driving up and dropping off cases of these things to us. They have just been amazing. Our local Harbor Freight has donated all of their N95s to us, as well as we have been very supported by our local Lowe's and Home Depot. And it has been amazing, and the support that they have and the appreciation that they have for our workers. I would encourage anybody who is getting feedback from their community. One of the most amazing things is, with the schools being closed, we had a group of teachers who drove through our parking lot with signs out their windows thanking all of the employees and healthcare workers for all that they're doing for the community, and the employees were just thrilled. So even the smallest response from the community and support has made people smile, and it gives them, a bit of a recharge and a reboot, knowing that we anticipate things to get much worse, but knowing that the community is out there to support us has just been amazing.
That's incredible. I really appreciate the story where you have the educators that are actually coming to show their appreciation for, the heroes within the healthcare community right now that really are, in many cases dealing with situations they never had to tackle in the past. And I love the fact that your community really united together and that you've been getting personal protection equipment from other organizations and that they're dropping things off. I think the one thing that's going to come out of, what we're all dealing with the coronavirus and the current pandemic is I've seen more of a community atmosphere in the past, 2 to 3 weeks than I have in probably the last, several decades. Everyone is just uniting, or at least since, 9/11, people are uniting, coming together and really approaching this from what can we do to help? And I see a lot of service. So I love that idea. And anything that anyone can do to support the healthcare organizations in today's environment is really important.
Well, thank you so much, Stephanie, for letting me participate. I apologize. I am going to have to jump off for another meeting, but thank you again.
That's okay. Thank you for joining, Diana. We appreciate your insight. So with that, we heard some great information from Dianna LeVeck on what is happening within Zanesville, Ohio. And as I've shared before, we're going to continue to bring stories from across the country to all of you so that we can share different perspectives and hopefully address situations that are going in local communities, both small cities as well as large cities, rural areas, and critical access. And with that, I'm going to toss it to Pete Stille. Pete's going to give us a quick update on some PPE updates and just a continuation of information that he shared with us last week. So with that, Pete, go ahead.
Thank you, Stephanie. Again, this is Pete Stille. I'm CEO with Strategic Sourcing Results. We're a consulting firm here in Chicago, and we're focused on the healthcare supply chain. And we've seen a lot of activity this week since our last call. Increased activity really in alternative sourcing methods, some of which does include some important pieces of the community. So it was great to hear that conversation. So the first thing that I want to update everyone on is that we are starting to see government shipments of the ever elusive N95 mask. Some states are getting their orders filled completely. Georgia, Florida, Oklahoma were noted as being able to receive their full allotments. Some of the more challenged sites, the hot spots, Illinois, New York, are getting some just are what we call back ordered, and some are getting a couple, 10% of the order filled, some are more than half. The good news is it's happening. And the way it works for those that are wondering, it goes to the emergency response, the regional hospital takes over the reception of the supplies from the federal government, and then they distribute it throughout their region as allotted. So that's good news. Also, on Tuesday, no, it was Monday, there was some guidance given that these N95 masks can be sterilized through the SteriAd autoclave. I have not yet heard that Stericycle's sterilizer is approved yet, but for up to 2 uses, you can you get more use out of one mask. So that was good news for a lot of people. And if anybody needs the white paper on that, you'll have my email at the end of this section for follow-ups. The email has been blowing up this past week with everyone searching for PPE and sharing good thoughts. But again, in the community spirit, it's been a great discussion to have, and people are definitely willing to share their best practices and their ideas out there. Something else that we're starting to see is more manufacturing for portable autoclaves. This is re-sterilizing the masks up to 3 times, and it only takes 1 minute, and you can put it up on the units for the providers to do. Afterwards, there's thoughts that they'll use that just to help sterilize cell phones that come into units. So I know Carl Found in Illinois has purchased a few dozen of them, and there's increased shipments and interest in this. It's a steam technology for sterilization. We talked last week about 3D printing. Georgia Tech has shared 3D printing blueprints, and it does have volunteers now making face shields. And one thing that I noticed from my call with ARM last week was a lot of discussion about corporate donations. So it really is important to be in contact and thinking about what you can do from a community perspective to support your local hospital, as well as making sure you're reaching out to business partners that know what you're looking for and how they could donate to the organization things that they don't need. There's the N95 masks, of course. There's some repurposing of materials that have got level 3 protections that you can make into gowns. There's a lot of different things going on out there. The problem is there's so much going on, it's not well coordinated. So I did want to let the community know that AHA is working with a few organizations to launch a clearinghouse. It's going to be up in mid-April, and I'll report back when it is up and live and ready. But this will be to identify people who need masks and people that have them outside the local communities, as well as other PPE equipment. In the meantime, I would suggest to reach out to the AHA, the American Hospital Association. They're acting as a hub in the meantime. In addition to all this madness, you can imagine it's hard to keep up from the supply chain perspective on what's safe, what's truly meeting regulations, what's a fraudulent supply and what's not. So there's good guidance out there, and everyone in the supply chain profession is well versed on what they need to do. But this has brought up some new questions, such as can you trust an N95 from China? And if there's any doubt, if it does have the stamp, that's typically what people look for. But if there's any doubt, people are taking it down to the lab and testing. If they have the ability to test it beforehand. And I did get some information that some organizations are even taking products that are beyond expiration, taking that down to the laboratory and seeing if they're still appropriate to be used in the clinical setting. So the labs are getting taxed. The infectious disease docs are getting taxed and being asked a lot. The infectious disease nurses are really working overtime to make sure that everything is properly reviewed before it comes into the hospital and serves the employees and the patients. Then I think I wanted to close with a couple of things. One, for the association, if you are, for the people that are listening, if you are interested in hearing more about what the organization is doing, MIT does have a webinar coming up talking about different approaches here, and then the HFMA, that Healthcare Financial Management Association, has got a webinar coming up. I think both are next week. And if you want more information about that, please feel free to reach out. Other than that, the only thing we've been talking to clients about differently than last week, a few have reached out, and for some this is automatic. For others, to look at it a little more deeply is, what is your policy for paying suppliers? And a lot of my clients were looking at extended payment terms to help them manage cash flow throughout this time. So some are doing that to make sure that they're not hurting the local suppliers that are also feeling some cash flow crunch, and it's tough everywhere. So this is putting a strain on the entire system from the beginning to end. But that is a strategy that people are looking into right now. So that is my supply chain update for today. Thanks for having me on again, Stephanie.
Thank you, Pete. Really appreciate the update. And I think some of those strategies are definitely things that our clients and the industry at large can use. We had a couple requests for the actual white paper, so we'll make sure that we continue to do that. And we also have a question talking about, is there a general shortage of regular surgical masks prior to the outbreak, or is this just caused because of the outbreak that you're aware of, Pete?
It's caused because of the outbreak.
Yeah. So I think, in general, before this outbreak, there were an ample supply of most of these, PPE equipment pieces. But because the outbreak actually came on so quickly and grew so rapidly, we're stretched beyond, what we've typically seen. The good news is, healthcare always responds and adapts to situations. And I think that as we work our way through this pandemic, we'll be much better prepared for the next one. So Pete, thank you so much for your update. We'll make sure that everyone has copies of your contact information if they have additional questions and that they can connect with you. And with that, we're going to welcome Ken Kachmar to the table. Ken works with Boston Scientific, and we're going to get some unique perspective from Ken on what the organization has done in response to the coronavirus outbreak, and also some of their strategies for how they've adapted quickly to move more remotely. For the majority of you on the call, I'm sure you're well aware that when you're dealing with the actual supply chain within healthcare, a lot of the vendors have to supply equipment to the operating room and are used to actually being in the operating room as these procedures are ongoing. So as the patients are performing and as the providers are there, they're actually in the room assisting and providing guidance and teaching and details. And as you can imagine, like the rest of us, now that we're working in a 6 feet social distancing environment, they've been forced out of the operating room and into different situations. So Ken, we're really excited to hear what you have to share today, both about how Boston Scientific has adapted to being a little bit more remote, your situation, as you are located very close to the New York City Metro, and what you're seeing there, and just sharing information in general. So welcome. I'm really looking forward to hearing what you have to share.
Well, thank you, Stephanie, and to the rest of the panelists, and thank you again for hosting these kind of collaborative events. I did listen to last week's and found it really insightful and informative, and I think this is a time, as it's already been mentioned, that everybody is pulling together and uniting and sharing our best ideas, our best insights, best technologies, best solutions. So it is an amazing thing to see, if you want to call it a silver lining through it all, of how many organizations that typically would be competitive, including those that we compete with. We're all in this together. We're just trying to do our best to find the best solutions to get us all through it. So again, I can't thank you enough for hosting. So just a brief background from me personally. I've been in this medical industry and medical device space for about 25 years, and before that, I was a critical care nurse. And as you can imagine, in any critical care setting, of course, there can be some pretty intense moments. And one of the things I always remember one of my physicians saying is, when the heat is on, facts are your friends, and being calm can be contagious. So in a critical care space, there's that readiness that you're always, expected to perform, even though it doesn't happen that often. But in this situation, I think with everybody dealing with a variety of different emotions and challenges, I think we just have to rely a lot on facts and just, kind of revisit those and just calmly kind of approach this from a solution-based setting. So with that being said, one of the areas that we are focused on and have been since 2015, as you could see on the screen, there was a consensus statement out of the Heart Rhythm Society, and back in May of 2015, that basically created a standard of care for remote monitoring for cardiac device patients. So those cardiac devices included pacemakers, defibrillators, and biventricular defibrillators, and then eventually evolved into implantable loop recorders, which can monitor arrhythmias for patients. So the kind of ironic thing here is we're coming up on a 5-year anniversary to this consensus statement, which after this came out, there were plenty of organizations across the country that moved to adapt this pretty quickly. And over the last 5 years, there's been a wide range of adoption. So there are some institutions perhaps that have close to 95 to 98% adoption. And then there's institutions that have, maybe closer to the 50%, 60% range as far as adoption in their institutions for a variety of reasons. So again, going back to the fundamentals and facts, this has been around a long time, and all of our competitive companies as well offer some sort of technology that can help institutions right now if you're not dealing with kind of a increase in the coronavirus, now is the time to really start revisiting your device clinics and engaging your staff and reaching out to those patients who might have remote monitors at home, but either they're just unplugged or there's some sort of other issue that they just didn't want to be compliant. But right now we've seen a rapid increase in the Northeast, especially New York City and New Jersey, with making sure every patient that has a remote capable device has a monitor at home that they can take advantage of. So that being said, the one area that we never really expected to see this technology be utilized was in the environment we're in today. So can we go to the next slide? Do I have control of the slides? Oh, there it is. Okay. So one of my jobs as a clinical education manager in the Northeast is to keep people informed, obviously provide best practices and create strategies around what's needed to provide our customers with the technology that we have. And when this whole thing started to hit pretty quickly, a lot of our employees were not well versed in the chain of infection and these hierarchy of control measures that infectious disease physicians deal with on a regular basis. So what you see on the screen was pulled from NETech, and I wasn't fully aware of what they offered, but they are a pretty amazing resource. And the National Emerging Special Pathogen Training and Education Center, they offer plenty of educational resources. This is one that I recommended for our employees, just to get a good sense of the environment that we're asked to go into on occasion. Now we just need to understand how to protect ourselves and some of the controls that are being implemented by hospitals, certainly in the Northeast, but across the country. So when you look at that pyramid, the hierarchy of controls, the interesting thing that I learned coming out of this was that substitution was a very important part of reducing risk to everybody, right, including people on the front line. So the substitution part, they give an example in this educational module of removing equipment or personnel, unnecessary personnel, but still being able to provide the care. And what you see on the screen there is a video link. And of course, everybody's focused on telemedicine, which is pretty much turned into tele everything. Anything that we can do remotely now, I think really should be explored, especially in the areas of the country that haven't seen that increase yet. So what we've been able to do is, with all of the technology that's been evolving, even though this remote technology was intended for, patient monitoring at home, there is now the opportunity for newer technology, which literally just got some recent software approval this week from the FDA. And if you want, you can go to the next screen. There's plenty of different technologies that are available. The one that I'm going to highlight today is a technology called Heart Connect. And what Heart Connect does is it allows specialized electrophysiologists or nurse practitioners in a device clinic to be able to remotely connect live with either a remote agent in our home office in Minneapolis or our field personnel, our engineers that can basically be there and observe an interrogation of a device during a device check. They can also remote in for an implant. And as you mentioned, elective procedures at this point have pretty much been eliminated. The Heart Rhythm Society, ACC and AHA just came out with an announcement this week listing those procedures. So there are only emergent procedures being done. However, there are still patients who need medical devices. And as recently as this past week, we've done remote support during an implant, during several implants actually. And this Heart Connect allows for the engineer or remote technician to not only observe, but also navigate, annotate. The only thing they can't do is push a button and make a change, right? The clinician in the room actually has to do that. So again, it wasn't something we expected to see as a value in the way of an infectious disease crisis, but under the circumstances, it is something that is providing a solution for some of the areas. And if you go to the next slide. So that Heart Connect used to be a separate device, and now it's going to be included on the traditional programmer that people are used to using in their operating rooms and in their clinics, which makes it a lot easier to connect with remote agents. There's less equipment involved. It uses either Ethernet, Wi-Fi, or 4G adapter. So most of these places can get up and running pretty quickly. And one example in New York City that happened 2 weeks ago, where the representative from the company went to support an implant, and the physician had informed them that that was going to be the last day, because hospitals will eliminate unnecessary personnel from entering hospitals at some point, but they still needed that support, and that's where they started to really scramble for solutions. The good news was this was one of those hospitals. In fact, one of the authors on that consensus statement, and they had already adopted some of this remote technology to a large degree in their clinic, and they were able to kind of move that and streamline it into the operating room and be able to adapt it within 12 hours and get it up and running. So the good news for the folks on this call is there are a lot of remote technologies that can be helpful to either prepare for if you haven't been dealing with it yet, or if you're in the midst of it. These can be brought up to speed pretty quickly in most institutions. And if you go to the next slide. So this is just an image on the bottom left of a programmer screen, and on the very bottom right of that is an image that is just of the operating room. So that literally is a photo from a remote agent who is interacting in real time, and this is just happened recently, but it's through that programmer that you see on the screen. So everything now is in one system. It can again be used via Wi-Fi or Ethernet or 4G adapter. So I would just simply say explore through your cardiology departments what technologies they may have already on site, and some may be up to speed quicker than others and be ready to go. And again, others who may not be familiar with this technology, which we found to be the case in some places, it doesn't take long to get this technology in their hands and provide a solution. And if you go to the last slide. So this one, and I appreciate what the other panelists said about employees and how important employees are to everybody. And it's no different in our space, right? We have established over the last several years, a culture that really cares about the people first. And the one thing that I have kind of noticed and become very passionate about is making sure that we take care of our well-being, and we all want to be productive, especially in the virtual world. But we found it to be challenging, for most of us. So what we've done is develop access to, and we found great resources from a variety of sources that you see on your screen there, just in the way of saying, look, the one thing that we're not running short on is emotions. We all have different ways of handling that, and we've got to find ways that we can focus on keeping ourselves mentally strong, mentally healthy. So one of those ways is through this Yale website called The Science of Wellbeing. And that's literally a 10-week class provided by a professor of psychology, Dr. Santos. And I've registered for it. Plenty of our staff has registered for it. We've gotten a lot of positive feedback on it. It's a self-directed course. There's no timelines involved, but it really does meet the need and provide a lot of insight on everything from how the brain functions, how we process emotions, the difference between the limbic system and the rational brain, and then tricks and tips that we can use and should be using on a regular basis. For us to be productive, we have to keep ourselves mentally healthy. The second one that you see there on why leaders need meditation now more than ever caught my eye, but that was provided by Harvard Business Review as a free resource now for anybody who wants to access it, and they're going to continue that, I believe, until it's not needed. So there's some great resources on there, but again, if you notice, it supports the idea of meditation, mindfulness, and then in the middle there you see logic, mind, and health. We're lucky enough to have our own subject matter expert in New Jersey. His name is Brandon Hall, and he has his own website, and he's created some podcasts and also wrote a book. But he is a huge proponent of one of the basic things we all really should be thinking of is establishing a clean routine every single day. Start your day in a good way, end your day in a good way. As much as we need to be updated in the news, try your best not to end your day with it. Don't spend too much time in it. I agree, we get a lot of information and helpful information from Twitter and other social media sites, but get what you need. It's kind of get in, get out, and then focus on yourself. And then the last part, these challenger websites are more business related, but they are tailored and customized setting, and just how we can adapt to the new virtual environment. And these are ongoing webinars that are recorded, and just like you're doing, pulling people together with best practices and sharing what we need. And the last thing I'll kind of say and leave you with is earlier in this year, as part of our initiative to keep focus on our people, another colleague of mine and I went down to Florida, and were trained in being able to deliver emotional intelligence workshops. And for those that are really tapped into EQ, we know how important it is, in the way of just personal and professional success. And the one thing that I learned that kind of alarmed me at the time, and I can only imagine how that's increased now, is that on any given day, every person averages about 30 emotions per hour that we have to process, and that equates to about 500 per day. And if we don't have good strategies on how we do that, we become very reactive, and it just snowballs one on top of the other. So the one thing I would just highly encourage is whichever source and method you choose, just find a way to recognize, understand, and manage the emotions you're dealing with. And the better we can do that, the more productive we can be for each other and helping each other get through this. So thank you very much for inviting me on.
Yeah, Ken, I think right now mindset is so unbelievably important as we all work to manage and adapt to the current environment that we're living in. And the one thing that I really found interesting about the Logic Mind and Health site is it's really about how our brains are currently wired for stress, and everything that's happening is wired for the reaction of stress. And I think in today's environment, as you mentioned, don't wake up in the morning and turn on the news, because then you're wiring your brain for stress and you're wiring your brain for fear. And the more fear that you have, the more cortisol is released. And the more cortisol that's released, the more stressed that you are. And the more stressed that you are, the lower your immune system is. And the lower your immune system is, the more susceptible you are to viruses. So I think all of this information is extremely important right now, given what's happening. And I think embracing all of it's important. And one of the things that I really found interesting at Boston Scientific is, as I was preparing for this call with Ken, is they really put together a remote strategy around how they were going to deploy with their employees. And I think it's very important, as I mentioned earlier, to have that accountability structure in place, but to also have the communication. So as they rolled out to moving to the home office environment, in a lot of hospitals and healthcare systems today, we're taking a portion of employees and we're moving them into remote space. Just as Ken mentioned, they had to take some of their in-house technicians and engineers and now have them working remotely. So as this happens, you have to really focus on, what are the tips that you're providing to your employees for them to connect to the home office? What tools should they have in place for project management? How are you going to check in with them for the virtual team experience to ensure that all projects are currently keeping on track? And how can you really make sure that you have that team environment? So one of the things I love that Boston Scientific did is they really put together a strategy around how they were going to organize, how they were going to communicate, how they were going to meet, and then how they were going to actually humanize the experience. So to make sure that they're setting up those status messages and having a calendar that keeps the team united and really work together. So I commend the organization for that, Ken, and I really appreciate all the information that you shared. And if I could just end with one question, given your proximity to the New York City location and some of your experiences as a former RN and the context you currently have in the field, from a more clinical perspective, what are some of the things that you're hearing from contacts? What are you seeing? What are you seeing happening?
Well, as you can imagine, the stories aren't, they're not great. And for those that are in New York City, and I've got plenty of colleagues that are, in New York City and the surrounding boroughs, it is it is really a difficult situation to see. I mean, it really is just upended a lot of people in just the ability to even believe that it's real, right? And I know people say often it's such a surreal experience, but it truly is. So, I know there are images now out there where everybody's seen the image of the ship coming down the river next to Manhattan, um, and the Samaritans group that set up the hospital in Central Park. And then I saw images as well, where hospitals have these tents set up where ambulances used to be parked, outside the emergency room are now, white tents just to put, the overflow of people in it. So even with all that going on, the one thing you'll see consistent from the community, and this was mentioned earlier, the support of the communities, the support of the healthcare workers, and I know it's a difficult time, especially in New York and New Jersey. Um, everybody is doing as much as they can to rally together and support one another. And I think that's probably the most important. I mean, all of the companies, like I said, we are so far from thinking anything competitive with one another. We are pulling resources, even locally, to provide, whether it be food or supplies, as much as we can, to our local hospitals and our colleagues. So listen, it's not easy, and I know not every part of the country has felt that, and I pray that it's not going to turn out to be that. Um, but again, just in what I'm hearing from the people on your calls, steps are already being taken that I think people will be much better prepared than New York was, when this thing first started.
Yeah, I really appreciate your insight there. I think the one message that I really heard is that we can all learn from the experiences of others. And as different communities and different cities and different hospitals are experiencing that, we're seeing what they're doing. And what I'm seeing within the community of healthcare in general is a lot more collaboration. And that's not just only within the United States, but it's, what the United States experience is versus Italy versus, China versus Canada, and just coming together as a community and learning from each other. I think it's a great perspective of where we are. I know we do have one question that came in, so I'll let Brian ask that question, and then we can wrap up.
Okay.
All right, Ken, we had a question submitted, and the question is, do you see the potential for remote participation during implants being adopted as a new norm going forward?
I would probably say not as a new norm. I think it would just simply be as an option when needed. And I don't believe the strategy was ever to make that part of the remote care continuum. There's been plenty of articles published in Modern Healthcare, for instance, several years ago on the difference between, let's say, a cardiology space and an orthopedic space. Cardiology is what they kind of describe as a very high touch kind of collaboration where our engineers and our field personnel are providing, a fair amount of technical support during an implant process. So I think having the technology to support it is amazing. I don't know that even physicians would want to make that a permanent solution moving forward, just because of the variety of things that happen during an implant. And as the more complex cases that you perform, such as these biventricular implants, and now conduction system pacing implants are happening, there's a lot of interpretation and troubleshooting that has to happen during some of these longer cases. So I would say it's not likely going to become a new norm. What has become the new norm are these remote clinics. So I think patients who are normally faced with traveling, and if they just think about this now, for all those clinics that have remote technology up and running, all those patients that are remotely followed, they don't have to come out of their homes, right? So that we really want to see, and I think every physician would want to see that now moving forward. I do think you'll see a rapid adoption to device clinics. The one thing I did not mention also, by the way, was MRI suites. which I think is a really important piece of the puzzle, because right now there are still patients with cardiac devices who still need MRIs for other reasons, and that has become another source of using these remote views where you can do with Heart Connect and be able to help a clinician who may not be well versed in a cardiac device, help them understand how to program it to prepare for an MRI, help them understand how to interrogate and understand how to program it back after an MRI. And it really, again, takes that NETEC hierarchy model and says, if we can eliminate the interaction between personnel, obviously we're going to keep them safe, we keep ourselves safe, we keep patients safe. So on the implant side, I don't see it being a new norm. On every other remote aspect for patient care, I do see it being a new norm.
I think that's a great point. We're starting to see that in other areas as well, ranging from oncology services to even respiratory therapy, where there's remote oxygen monitoring. We're seeing it actually come to the forefront now with behavioral health, with a lot more remote sessions and virtual sessions compared to situations where those patients would have to come into the city or come into a clinic and drive 20, 25 minutes. So I think what's going to be left at the tail end of this is everywhere that it makes sense to continue with the remote monitoring because it's easier for the patients, more accessible, better quality of care, will continue. But for those situations like Ken touched on, I think we're going to continue to see those businesses emerge and continue operations that they had been prior to this situation. But the great thing is that all the technologies that are coming to the forefront now are going to help us all with the quality of care moving forward. And ultimately, it's going to give us better access to monitoring the health of our patients.
Yeah, and if I could just mention one last thing. So on that consensus statement, in 2015, in part of the conclusion, they had mentioned that one of the things, after pulling all the randomized trials from around the world, that they concluded was that there is meaningful benefit to patients by just being remotely monitored from home. That's in the normal, everyday kind of care situation. So there are clearly well-defined and well-established morbidity and mortality benefits to patients just by being remotely monitored for a variety of reasons. And I, kind of transition that now to an implant side. I know it's not been studied on the implant side because we're just, using that right now just in an emergent situation. But like I said, it was never part of the intent, and I don't know that anybody would even really want to study it because there's just too much variability that goes into these implants, I think. So again, as a short-term solution, for sure. But remote monitoring, I would just say again, the morbidity mortality benefit for patients, well published, and I would see that as a rapid increase almost everywhere now.
Excellent. Well, thank you so much, Ken, for your information and insight. It's been very valuable. I'm sure your listeners find it extremely useful as well. And what I just want to close with is, as ALTIUS Answers and the ALTIUS Roundtables continue, we really like our clients and others to submit any questions or topics that you'd like to see us address. We're going to have the roundtables continuing every Thursday at noon throughout the month of April and May, most likely. And then we'll move to a different format. But for now, make sure if there are any topics that you're interested in learning about, hearing about as it relates to your organization, the community, different situations, please reach out and ask those questions, as well as suggest panelists or any individuals that you'd like to hear from. We're here to support you, and we want to provide you with the best information possible. So with that, I hope that everyone found this information useful, and I look forward to seeing you on the next episode of ALTIUS Answers, as well as the ALTIUS Roundtable. Thank you very much, and enjoy your day. And also, thank you to all the heroes within healthcare, the first responders, the clinicians, the nurses, the doctors. Right now, the hours that you're spending tirelessly caring for the patients and putting yourself in difficult situations each day, ALTIUS really appreciates you, and we appreciate your support. Thank you, everyone.
This virtual roundtable discussion was brought to you by ALTIUS Healthcare Consulting Group. For more information about anything you heard on today's roundtable, or to learn about services provided to hospitals and healthcare delivery systems by ALTIUS Healthcare Consulting Group, visit our webpage at www.altiushcg.com. To be able to get updates on future roundtable discussions, please send an email to info, that's info, at altiushcg.com, and let us know that you'd like to be added to our mailing list. Those on our mailing list will be the first to find out about future roundtable discussions. Thank you so much, and have a great day.